Did you know some routine medical tests for people over 65 could actually do more harm than good? Every year, countless seniors face checkups that spike anxiety, trigger preventable complications, and drain family budgets. Let's uncover the hidden risks your doctor might never mention. Studies have shown that over 60% of seniors over 75 receive at least one unnecessary test per year, and in some countries, this number reaches up to 75%. If you are over 65 or have a loved one in this age group, this video is prepared for you to make decisions with an open and informed perspective, decisions that are truly in the best interest of your health and peace of mind. Now, let's go step by step and examine which tests are truly necessary and which ones might sometimes cause more pressure, anxiety, and extra costs than they are helpful. Let's begin. Number 1. Colorectal cancer screening with colonoscopy and fecal tests. Colonoscopy is effective for identifying and removing precancerous polyps, but its net benefit decreases with age, especially after 75. In very old age, it's usually no longer a routine recommendation. The reason is clear. Many polyps take years to become dangerous, and when life expectancy is less than the necessary period to benefit from the screening, the balance shifts toward the risks. The preparation process itself can cause dehydration and electrolyte imbalances in seniors. Sedatives used during the procedure carry a risk of hypotension or irregular heart rhythm for some individuals. Bleeding after polyp removal is not an uncommon occurrence, and while perforation of the intestine is rare, it can lead to severe life-threatening complications if it happens. Studies show that about 3 to 5% of seniors over 75 who undergo a colonoscopy experience serious complications. If you consider fecal tests as a less invasive option, be aware that a positive result means a targeted colonoscopy is needed, not the start of an endless series of screenings. Studies have shown that colorectal cancer screening in individuals over 75 may have limited benefits and in some cases pose more risks than benefits. For example, one study showed that screening in people over 75 was associated with a 40% reduction in colorectal cancer mortality. But these results may be less significant in individuals with a life expectancy of less than 10 years. Also, the average cost of a colonoscopy for seniors over 75 is about $2,500, and this doesn't include costs from potential complications and follow-ups. Number 2. Prostate cancer screening with PSA. PSA is a number, not a diagnosis. Its increase can be due to inflammation, benign prostatic hyperplasia, or even recent activity. In seniors, a significant portion of prostate cancers grow very slowly and never reach a life-threatening stage, which means there is a risk of overdiagnosis. A borderline PSA can put you into a cycle of repeated tests, MRI, and then a biopsy. Although a prostate biopsy is an outpatient procedure, it carries risks of infection, bleeding, and urinary problems. And a severe infection, though rare, can occur. About 2 to 4% of biopsies lead to a serious infection. If a low-risk cancer is diagnosed, aggressive treatments like surgery or radiotherapy can be accompanied by urinary incontinence and erectile dysfunction. In some studies, 15 to 30% of men experience incontinence and 20 to 40% experience erectile dysfunction after surgery. This is why in many scenarios, active surveillance is a more logical option. A study in the UK reported that up to 5,000 men per year may receive unnecessary treatments for prostate cancer due to outdated national guidelines that lead to over-treatment. These unnecessary treatments can lead to complications such as erectile dysfunction and urinary incontinence, and the average direct cost of each unnecessary treatment is estimated to be around $10,000 to $15,000. Number 3. Breast cancer screening with mammogram. Mammogram has saved lives, but in older age, the decision becomes more complex. Studies show that in women over 75, about 10 to 15% of mammograms are false positives, leading to ultrasounds, MRIs, or even biopsies. These follow-ups cause significant psychological stress. One study found that about 20 to 25% of women over 75 with a false positive mammogram experienced severe anxiety and sleep disturbances for several weeks. In terms of safety, the radiation dose from each mammogram is low, about 0.4 MSV. But when the net benefit is uncertain, this dose and the pain from breast compression must also be weighed in the decision. Also, the average cost of a mammogram is about $150 to $200, but if additional follow-ups are needed, the total cost can reach $1,000 to $2,000. Based on guidelines from the American Cancer Society, women over 75 should decide whether to continue mammogram screening based on their health status, life expectancy, and individual priorities. Research has shown that in this age group, about 30 to 40% of screening decisions require a personal discussion with a doctor to avoid unnecessary testing. Number 4. Cervical cancer screening with pap smear and HPV. For women who have had repeated negative results until age 65 or have had a hysterectomy for non-cancerous reasons, continuing the screening usually offers no benefit. The reason is simple. When the probability of finding a significant lesion is less than 1%, any ambiguous result can lead you into a cycle of false signals, colposcopies, and unnecessary biopsies. Studies show that about 5 to 10% of women over 65 who continue screening will get false positive or ambiguous results, which can cause anxiety, additional costs, and frequent visits. The average cost of a colposcopy with a biopsy is about $1,000 to $1,500, and rare but serious complications, including infection or bleeding, are reported in 1 to 2% of cases. If you have a history of abnormal results or specific risk factors, the decision should be individualized and made with your doctor. But for women with a negative history, a logical stop to screening is a safe and wise choice. And studies have shown that the risk of missing a real lesion in this group is less than 0.5%. Number 5. CT scans and other high-radiation imaging. CT is a powerful tool, but this power comes at a cost. The radiation from an abdominal CT is about 10 to 15 MSV, which is approximately 300 to 500 times that of a simple chest X-ray. Frequent use can increase the risk of radiation-induced cancer by 0.5 to 1%. The iodined contrast agent can increase the risk of worsening kidney function in individuals with kidney disease or diabetes by 5 to 10%, and rare sensitivity can cause anaphylactic shock, about 0.1%. The biggest trap of CT in seniors is incidental findings. Studies show that 20 to 30% of abdominal and chest CTs in people over 65 find nodules or spots that are often benign but lead to additional follow-ups, more CTs, and even biopsies. The cost of each CT is about $300 to $1,000, and follow-ups can add 2 to 3 times this amount. The safe strategy. Imaging is only valuable when its result changes a treatment decision. Otherwise, the likelihood of entering a cascade of care and increasing anxiety and cost is high.
Number 6. Extensive hormonal tests without symptoms. Hormone packages with a long list including thyroid, testosterone, cortisol, DHEA, and sometimes growth hormones are often attractively offered to seniors, but in reality, these tests can put you on a path of complication-filled and useless treatments. For example, in seniors, A slightly elevated TSH might be completely normal or temporary. An unnecessary treatment with thyroid hormone can cause heart palpitations, irregular heart rhythm, and even an increased risk of stroke. Testosterone, without a proven deficiency, can increase the risk of blood thickness, edema, worsening prostate problems, and cardiovascular events. Evaluating the adrenal axis with scattered tests is also usually misleading and can lead to unnecessary imaging or complication-filled treatments. Studies show that non-targeted hormonal therapies in seniors can be associated with a 30 to 50% increased risk of stroke, heart failure, or arrhythmia. In addition to physical risk, the psychological stress from borderline results is also significant. Anxiety about potential illness, worry about treatment side effects, and a feeling of dependence on the healthcare system can reduce quality of life. Financial costs also include repeated visits, hormonal medications, supplementary tests, and unnecessary imaging. Practical tip: every hormonal test should start with a real, verifiable symptom. Testing simply for reassurance or following promotional packages often leads to physical, psychological, and financial consequences. Number 7. Heart angiography without strong symptoms. Heart angiography is a very precise diagnostic tool that can show blockages or narrowing of the coronary arteries, but in seniors without severe symptoms or stable coronary artery disease, routine use is often unnecessary. Studies have shown that performing angiography in asymptomatic patients is associated with a relative risk of complications of 3 to 5%, and these complications can include bleeding, vessel damage, catheter entry site infection, and even, though rare, a heart attack or death. In many cases, medication and lifestyle changes, including a proper diet, regular exercise, and blood pressure and cholesterol control, are the first line of treatment and can help achieve similar results with reduced cardiac risk. One important point in seniors is that every angiography should be linked to a specific treatment decision. If performing angiography doesn't change the treatment plan or the immediate need for a stent or open heart surgery, putting the patient on an invasive path can only create additional psychological and physical stress. Research has shown that many seniors experience more anxiety and worry after unnecessary angiography, and some have even reported a decrease in daily activities. Therefore, the key to decision-making in this case is a careful evaluation of the patient's condition, defining the purpose of the test, and ensuring that the result will genuinely change the treatment plan or daily life plan. Number 8. Unnecessary biopsies. Biopsies are valuable when there is a strong suspicion of a malignant lesion, but in many cases, seniors are faced with imaging results from MRI or CT that show small nodules or spots. In these situations, rushing to a biopsy can cause risks such as bleeding, infection, local pain, and scarring. In the lungs, there is a risk of pneumothorax. In the kidneys, the probability of bleeding is higher, and in some deep areas of the body, difficult access increases the risk. Studies have shown that about 20 to 30% of biopsies in seniors may be unnecessary and only cause anxiety, cost, and disruption to daily life. Choosing a follow-up path with logical intervals instead of immediate sampling can reduce harm without compromising patient safety. The key to decision-making here is an accurate determination of the likelihood of the lesion being benign, a review of the medical history, and an evaluation of the patient's individual priorities to prevent unnecessary tests and psychological stress. Number 9. Allergy tests without a history of symptoms. Allergy tests are useful for individuals with a clear history of allergy symptoms, but extensive panels in seniors without specific symptoms can lead to many false positives and result in irrational decisions such as restrictive diets, nutritional deficiencies, or social isolation. Studies have shown that IgG food tests often only indicate exposure to the food item, and relying solely on them can lead to unnecessary medical interventions and unwarranted restrictions. If there are no specific symptoms, a simple daily log of symptoms and a targeted evaluation of exposures and triggers can provide a more realistic picture and a safer decision. This way, seniors avoid additional follow-ups, anxiety, and financial stress, and can focus on improving their quality of life and managing real symptoms. The key to success here is also the same as in points 7 and 8. Every test or procedure should answer a specific question, and its result should change the treatment or daily life plan. Otherwise, performing it only creates an extra burden. Now that we have learned about the most high-risk tests, we need to look at the consequences that are usually not written in the brochures. The psychological chain begins the moment an unspecified result appears on the screen. A few sleepless nights, fear of the worst-case scenario, and a mental focus on a body that has suddenly become suspicious. This anxiety isn't just a feeling. It raises stress hormone levels, intensifies vague pains, and reduces the desire for activity. Then comes the financial burden: repeated visits, travel, additional imaging, time off for companions, and increased home care costs. Families gradually adjust their daily routine around follow-ups, and life becomes a never-ending health project. Add to that the wrong labels that get put on the file: suspicious, needs follow-up, and every subsequent doctor, for caution, orders another test. This is the cascade of care that starts with good intentions and sometimes ends in burnout. In such an environment, a simple skill can make a big difference: shared decision-making. Whenever a test is suggested, before agreeing, ask what its exact purpose is for your situation, what you would truly lose if you don't do it, what its physical and psychological risks are at your age and condition. If the result is positive or ambiguous, what the next step will be, and whether that step will change your treatment plan or daily life plan. Is there a less invasive or safer option to try first? And given your life expectancy and personal priorities, such as maintaining independence, avoiding hospitalization, or staying away from complications, does the benefit truly outweigh the harm? If the answers are not clear, don't rush. Clarity is a friend of health. Now, let me provide a compact and coherent summary so the path remains clear in your mind. After age 65, colorectal screening with colonoscopy should be continued with caution and personalization, and in older ages, it's usually not routine. PSA can lead you toward overdiagnosis and complication-filled biopsies, and the goal should be clear before starting. Mammogram in older age is a decision that must be made considering life expectancy and individual priorities, and should also weigh the risk of unnecessary follow-ups. Pap smears and HPV tests usually stop after age 65 with a negative history. CT and high-radiation imaging are only valuable when their results change a treatment decision. Otherwise, they activate the cascade of incidental findings. Symptomless hormone panels can lead you to useless and complication-filled treatments. Heart angiography without strong symptoms sometimes causes harm instead of helping. And hasty biopsies and aimless allergy tests are common entries into the world of unnecessary complications and restrictions. The key to a safe path is that every test must answer a specific question, and its result must change the treatment plan. If not, stop and ask again. In the end, remember a simple truth. Health in old age is not just not having a disease. It means having calm, independent, and meaningful days. Any test that distances you from this goal, even with the intention of reassurance, must be reevaluated. You have the right to ask questions, demand explanations, and choose a decision that aligns with your values. If this narrative was enlightening for you, share it with someone you love and let more informed conversations take place in families and doctors' offices. In a separate video, we will talk about tests that are valuable and about real patient experiences. But here, the message is clear. Less is sometimes safer and wiser.